Hello. On this episode of Dementia Difficulties, we are covering personal hygiene. Although many of us take it for granted, the ability to take care of our bodies is essential to our well being. Dementia heavily impacts our ability to accomplish these tasks. Hygiene becomes increasingly complex as dementia progresses through the stages, adding more burden to the caregiver as they increasingly take on additional tasks. For the purposes of this presentation, hygiene will include the following: dressing, bathing, toileting, oral health, shaving, and nail care. To be able to dress yourself successfully, it requires a lot of cognitive ability. First, you have to remember to get dressed at all, or to change clothes. After deciding that you need to get dressed, you have to choose appropriate clothing for the weather or the situation. Next, you have to get dressed in the right sequence. At each step of the process, your loved one may struggle. Our goal is to make dressing as simple and easy as possible for your loved one. Depending on their cognitive level, there is a few different strategies to help your loved one through the process. It is best to adapt the amount of help that we give our loved one to best fit their cognitive abilities. For mild stages, consider the following: place signs on wardrobes and dressers, pictures if they are more advanced, to make it easier for them to understand and see. Reduce the outfit options available and make sure that they are appropriate for the weather. We don't want our loved one in 5 shirts in the middle of summer or in a short sleeve shirt in the middle of winter. Create a comfortable environment for them to get dressed. That means it's warm, well lit, private. This can also mean avoiding mirrors if they are confused by them. So this is especially common in the later stages. For moderate stages, consider laying the outfit out for them in order. Proper ordering ensures that they do not put their pants on and then their underwear. Make sure to give them simple instructions. Put your hand here. This goes here. And make sure, if they're comfortable with it, to use touch as a cue as well. If they are reluctant to change their clothes, use duplicates of their favorite clothing and swap their clothes for clean clothing when they shower. Bathing. According to Kono 2024, of all the caring activities, bathing is the most likely to lead to agitation. As many of you have unfortunately experienced, this agitation can manifest itself into aggressive behaviors such as biting, pushing, verbal assault, and restlessness. To further complicate the situation, many older adults with dementia have comorbidities that increase the difficulty of showering. Worsening eyesight, balance, and a decline in the musculoskeletal system can all affect bathing. While helping your loved one with hygiene is not easy, there are some things you can do to reduce the agitation felt during the process for both you and your loved one. Communication strategies. Communication techniques are an easy way to cooperate with your loved one with dementia. A very effective strategy is to use distraction. You can sing with them, turn on music, or just reminisce. Keep the conversation flowing through encouraging phrases such as, "You are going to look so nice for the dinner table. We will fix your hair using rollers," or other positive phrases. Much like we may turn on music for a run, it can simply be nice to think about something other than the activity that we dread. When talking your loved one through the activity or instructing them, using clear and concise language is best. For example, "Let's sit down. Watch me. Here is the soap." The shorter and easier to understand, the better. You also consider your feelings before the shower. Make sure that you are in a good state of mind, are calm, smiling, and approach where your loved one can see you. It can be a bonding experience to step into their fantasy or world and to go along with them. Your loved one can sense your agitation and frustration, so if you can express a positive attitude and meet them at their level, it can go a long way, even if it is difficult. Environmental modifications. Even though it's not an environmental modification per se, I wanted to stress the importance of being patient. It will take your loved one a longer time than someone without dementia to take a shower, and they are not going to be the most efficient. Make sure to complete this activity when you have plenty of time on your hands and can do it without a rush. Create a safe environment. To ensure that the person feels comfortable, it is important to give as much privacy as you can. Make sure the room is well lit, easy to move in, and free of clutter. If your loved one gets confused by mirrors, cover them, as we previously stated. Some helpful items include a heater. Many people with dementia often have sensory difficulties with it being either too hot or too cold. They are unable to directly voice this to you, and lashing out may be the way that they try to communicate that they are uncomfortable with their surroundings. Make sure to keep a heater and that the water is not too hot. Find a good balance. Music can be a great distraction and can make bathing a lot of fun. Sing the entire shower if it helps. Familiar scents can produce a calming effect. If you know your loved one was particular to a certain scent, make sure to use it. Handrails, bench, and bath mats can all reduce the risk of falls in the bathroom. So here's some miscellaneous tips that you may not have considered before. Try using a towel or washcloth. Sometimes an individual with dementia can have adverse sensory effects with the water hitting their skin. Placing a towel on their body where the water is hitting them can help reduce the discomfort from the water hitting their bare skin. It acts as a barrier and breaks it up. Perform a health check. Make sure your loved one doesn't have pressure sores, irritations, fungal infections, or any other kind of issue. The shower provides a good opportunity to look everything over and make sure that they are healthy. Make it a routine. If you know how your loved one performed their oral hygiene routine, a lot of the habits can be retained and used during ADLs. If they set things up a certain way, for instance, try to keep it like that. With them doing something for over 30 years, these are some of the last things to go once they're diagnosed with dementia. Toileting. As with the other activities in this presentation, dementia heavily impacts toileting. People with dementia struggle with knowing when to go, completing the proper sequence of toileting, and keeping everything clean while doing so. As with bathing, our goal is to make sure toileting is as simple and easy as possible, as well as safe. First, establish a bathroom schedule. It is ideal to help your loved one to the bathroom every 2 hours and after meals. In addition to this schedule, be sure to look for excess fidgeting, tugging at the genitals or clothing, or pacing that indicates that they need to go to the bathroom. These can be all signs with them telling you that they have to use the restroom. Now that we have a schedule and know some signs that your loved one needs to use the restroom, we will go over the actual act. First, make sure that the bathroom is dementia friendly, by using bright tape, signs, pictures, and other markers to identify the bathroom door and important items in the bathroom. Signs should be used as reminders. For example, flush or wash hands can be fantastic for your loved one. If your loved one is dressed in easy to remove clothing, it can increase their independence while toileting, or at least make it easier for you to take off before the act. Depending on their cognitive level, give them as much privacy as possible. As with bathing, if necessary, use simple prompts or a guided touch if they are comfortable to aid them in the task. Check for infections or other bodily issues as well. If an accident occurs, make sure to clean it well, in addition to providing ointments to prevent skin breakdown. The following is a list of toileting products that can be beneficial for people with dementia. For absorbent underwear, some brands include Depends, FitFlex, Prevail, which they offer both dailies and overnights, and Tranquility Premium Overnight. So these are just some suggestions. It's not an all-encompassing list. So feel free to try these or use something else if it works better for you. For washable bed pads, if they have an accident, Gorilla Grip and RMS are two examples. Disposable underpads include Chucks and Medline. Barrier creams include Destin, Calmos Septin, and butt paste. All of these suggestions can work and mostly serve as examples. If one of these do not work for you, however, make sure to look for alternatives or consult your healthcare provider. As with toileting and bathing, for oral hygiene, it is important to establish a routine of ideally brushing in the morning and at night. Depending on the cognitive level, the help required can differ. If your loved one has mild dementia, a visual or verbal reminder may be enough to cue brushing. If not, use simple cues such as watch me with a demonstration or like this. If they are unable, you can use the hand over hand technique to help guide their brushing. Make sure that the toothbrush is soft with a mild toothpaste to avoid agitation. Finally, make sure to check their oral health, signs for pain or bad breath, regularly. Nail care. Nail care can prevent infections, ingrown nails, and injuries from scratching. Dementia can cause the neglect of nail care, fear of nail care, and increase the risk of injury during nail care. Caregiver tips include: first, you want to prepare by soaking their hands or feet in warm water to soften the nails. Make sure to use clear and calm language with soothing music. Tools: you can use clippers with a good handle, a file to shape, and nail scissors. And as with the other activities, check for ingrown toenails and fungus. So shaving, some tips for shaving is to use an electric razor to reduce cuts. Supervise the activity if they can shave safely. And if they are unable to shave independently or safely, wait until they are calm to complete the activity. Use delicate skin products. So this slide is dedicated to respecting the need for personal space, as all these activities are very personal to each individual. Overall, we want to ensure that our loved ones feel respected while meeting their needs, especially during hygiene activities. To summarize, make sure to tailor your help to their cognitive abilities and grade appropriately. Establish a clear routine, be calm and concise when speaking, and visually inspect health concerns that your loved one may be unable to voice. Hygiene is personal and generally private, so this part of care can be intense. You're doing something that a lot of people are unable to do and should be commended for it. While your loved one may be unable to voice it, just know that you are making a difference. The quote for this episode of Dementia Difficulties is, "Some days are fuzzy, all days need love." Even though your loved one has a hard time voicing it, they appreciate and love you, and all of the care that you do. Thank you so much for joining me on this episode of Dementia Difficulties. The following is a list of links used for this presentation. Hygiene can be very difficult activity to complete while caregiving, so make sure to check out any of these links for further information. I hope you all have a wonderful day.